Good morning. I am Priyanjali, your host for today on ZTalk, a public awareness initiative on how we can protect our kidneys from damage and also to lead a healthy life. Because if our kidneys are damaged, we know the consequences. And if it's already damaged, we would want to know how can we have a normal life. To educate us on what's right for our kidney health, we have with us our expert, Dr. Arjun Ray, currently practicing at Kolkata, Behala, Dhakuria, as well as Howrah. Welcome, sir, to today's platform. This is being live here at ZTalk. Our first question for you would be, how important is kidney health for us? To keep our kidney healthy, how important is it?
Actually, we should always keep in mind that for a better kidney health, first 2 or 3 things we should always remember. Like if you are suffering from hypertension or high blood sugar, always you need to keep the blood pressure and blood sugar in control. Second, avoid always painkiller medicines. Don't take painkiller medicines as and when necessary. You can always take paracetamol on and off, but don't take the others painkiller medicines prescribed quite often. And thirdly, drink plenty of water. Normally, drinking normal plenty of water doesn't damage your kidneys. If you are suffering from like swelling of lower limbs or shortness of breath, then you need to restrict the intake of water. Otherwise, drink normal water and maintain a healthy lifestyle. Like 30 minutes brisk walking 5 days in a week. Avoid salt in your diet. All these things will keep your kidneys healthy.
Doctor, what is the common kidney problem which we see?
Now, like India being the diabetic capital of the world right now, the patients suffering from diabetes and more than 5 or 10 years, they are having these kidney issues. They are passing the froth in the urine. Some people are having swelling of the lower limbs. So we need to keep in mind, like those who are suffering from long-term hypertension and blood sugars, they need to check their routine blood parameters of urea, creatinine, potassium regularly. Always also you need to check the urine for spot ACR, albumin creatinine ratio or protein creatinine ratio on and off, like thrice in a year or twice in a year, so that you can actually check when the kidney problem has already started, right, before this gets too late.
Or blood pressure affect our kidneys?
Long-term hypertension, patients can have these kidney problems because ultimately this higher blood pressure will cascade to the kidneys. And sometimes always there is an inherent problem in the kidneys. There is an activation of the RAS system. All this will ultimately lead to the worsening of the kidney function.
Mm-hmm.
And the underlying cause is this proteinuria. The protein that is being leaked in the urine will cause the damage to the kidneys in the long run.
Right.
So 3 things you need to keep in mind. Always keep your blood pressure, blood sugar under control. Mm-hmm. And try to avoid extra salt in diet. As we Indians are prone to take extra salt more than recommended 5 or 6 grams per day. Recommendation is around 4 grams per day salt, but we always take 5 or 6 grams. All tasty foods contain salt. Like all the processed food, processed meats, the fries which are available, they contain extra added salt. So try to avoid.
Right. Doctor, how can we identify if we have a kidney infection or damage? What are the symptoms?
Symptoms, kidney problem can be like incipient. Like you may have no symptoms in the symptoms initially. Symptoms will gradually come on, creep along. Mm-hmm. Creatinine rises much late. So we need to see that if there is swelling of your both of the feet, you are getting froth in the morning sample of the urine that you are passing. You are having suddenly there is a jump in your blood pressure.
Right.
Your blood sugars are not getting controlled even with 3 or 4 medicines.
Mm-hmm.
So like you are going to pee in the toilet like 4 or 5 times at night. Need to keep this in mind. Swelling of limbs, passing froth in the urine is very important. So, and thirdly, passing too much urine at night after going to bed. These 3 or 4 things you need to keep in mind and avoid painkillers.
Doctor, what are the food or dietary changes which we need to take in order to keep our kidney healthy? And
Dietary changes, yeah.
Right.
I actually told you that avoid extra salt in that. Fatty foods you should avoid. Red meats we need to tend to avoid. Those who are having already kidney dysfunctional problem, you should avoid red meat completely. Fourthly, if you are having the habit of smoking, try to avoid smoking. Try to cut down on your regular alcohol intake. So these things we need to keep in mind. Healthy lifestyle is always needed. If you are getting overweight, try to reduce that. And for that, you need to go for a brisk walking any time of the day, morning or the evening, around 30 minutes for 5 days in a week.
Any food, doctor, which can be extremely beneficial for our kidneys?
Any kind of fruits, like there is no restriction as such for foods coming to the kidney health. You can take more or less anything, but avoid red meats. You can take eggs to try to avoid the yolk part. And you can have fruits if there is no definite contraindication like hyperkalemia, potassium is the blood is not raised. Then having fruits is also okay. So normal heavy fatty foods you should avoid, like the foods that are rich in saturated fat, like pizzas and all those stuffs. You should try to avoid. And like these fried chickens that are so much like available in the market and everybody is so fond of. So they are high in calories. Also, like these cold drinks, they're high in calories. Should cut down on the sugar intake. So we should always keep this things in mind.
Right. Tasty but harmful. Doctor, any message you have for our viewers, how they can keep their kidney healthy?
Like, first of all, you need to maintain a healthy lifestyle. Don't go for these painkiller medicines. Like, go for a big walking in the morning or the evening time. Control your blood pressure and the blood sugar, prescribed by your physicians. There are new drugs in the market that can cut down this protein leak in the urine in the long term. So there are many new drugs available. So you should visit your physician early if you want to stop that damage. And so when it has progressed quite long, like if the creatine is more than 1.5 to 2.5 or 3.5, more than 50% of your kidney is damaged. So if you pick them up early, then you can retard the progression and you can have a very healthy lifestyle.
Well, that was Dr. Arjun Ray for us on how to keep our kidneys healthy. Thank you so much, doctor.
Thank you.
Thank you, doctor, for your valuable advice. I'm sure all our viewers will be benefited from your advice. And viewers, do like, follow, and subscribe our ZTalk page on Facebook and YouTube. And to get more informations and right informations from renowned kidney specialists, stay connected, stay safe, and stay healthy.